Good morning. Thank you all for joining us today for our webinar. I'm Amy Miller, the Federal Grant Administrator at the Office of Planning and Research, or OPR. OPR is the state's comprehensive planning agency, and one of our many responsibilities is to provide resources and assistance on all aspects of federal grants. We serve as the state's single point of contact for the intergovernmental review of federal programs under the Executive Order, or EO 12372. And we hold trainings like this one to encourage and improve the ability of people and organizations in California to pursue and manage federal grants. Okay, great. So here you can see the OPR website, our page for federal grants. And this is where we're actually going to also be uploading the recording from today's webinar along with the slides. There's tons of information here to take a look through. This is also where you can go when you're applying for a federal grant and need to comply with the Executive Order 12372 intergovernmental review process. This is where you'll find a link to that portal, along with many other federal grant resources, including the OPR Federal Grant Update e-list, which is a weekly email newsletter that highlights the latest federal grant opportunities, news, and events. And again, this is also where we'll be uploading the recording and slides from today's webinar. If you have any questions throughout the presentation, you can please enter them in the questions tab. Next slide. And so now, before I turn things over to our presenter, I'd like to share a short disclaimer that the following presentation does not constitute legal advice and does not necessarily represent the views or endorsement of OPR, but is provided as a service to the grants community. And with that, I'd like to hand things over to our presenter, Leah Hyman from ACEL Grant Services. Leah Hyman, GPC, is a Senior Grant Specialist with ACEL Grant Services. Leah graduated summa cum laude from Kansas State University with degrees in English and International Studies in 2009, and then began a 10-year career in small business. Leah served as Communications Coordinator for the Greater Manhattan Community Foundation and worked as a grant services contractor. During her first 2 years of writing grant proposals, she secured over $100,000 in funding for small nonprofit agencies and has successfully secured $5 million in grant funding since joining AGS in 2020. And we're thrilled to have her here with us today. And so with that, I will turn things over to Leah.
Thanks, Amy. Hi, everyone. Welcome to Elements for Quality Project Design. As Amy said, my name is Leah Hyman, and I'm the Senior Grant Specialist at ACEL Grant Services. We are federal grant experts, writing proposals, helping clients implement projects, and writing reports for 50 to 75 federal grants per year for institutions of higher education, nonprofits, school districts, healthcare systems, and behavioral health centers. Today's webinar will focus on how to ensure you are presenting your program's quality project design. The two strongest tools for this in your proposal development toolbox are the meetings you hold to learn about the program that you're proposing to receive grant funding for, and how you describe the research or evidence base of your program design. I would encourage you, as Amy said, to put your questions in the chat. We'll try and stop a couple times throughout to take them as we go along, or we'll have some time at the end today to talk through that too. So this webinar is designed to help you grow in your knowledge of quality program design for federal grants, so you're as comfortable as possible when the time comes for you to collect data about your program and writing your proposal. This includes the project management skills necessary to collect the information needed to write a clear federal grant application, including how to describe the evidence or research basis for your program design. So let's start by stepping through how to design and run a series of proposal design meetings, tools to get consensus and information about project activities quickly, some definitions of evidence-based and research-based programming, commonly used evidence levels, and how to describe programs that are not based on evidence-based models, but that instead use research to guide the programming. Each of our webinar components today are aligned to the competencies and skills of the Grant Professional Certification Institute, who administers the Grant Professional Certified, or GPC for short. The GPC is the only nationally accredited credential for grant professionals. This credential is accredited by the National Commission for Certifying Agencies. ACEL Grant Services has more credentialed grant professionals than any other professional grant services firm in the country, which allows us to provide unparalleled services and support to organizations both large and small. All of our trainings have been approved for education points by the Grant Professional Certification Institute through their accepted education program. Participants in today's session can earn 1 education point for this 60-minute training, and these education points are applicable toward earning a GPC credential or just maintaining your GPC certification. To learn more, I'd encourage you to go to www.grantcredential.org. And today's training has also been approved by CFRE International for similar education points towards CFRE recertification with alignment to their domains and tasks. So the first thing I really want to talk about is how to develop a timeline and a checklist for your proposal. And the first key skill to learn in order to be successful with federal grants really is how to develop and manage the project timeline. This might seem simple enough, but the reality is that this is an independent skill from quality grant writing. I've known several amazing writers who still struggled with federal grants because they just couldn't manage all the moving parts. So like research projects you may have done in high school or college, a federal grant requires a strong understanding of what the project should look like when it's finished, all the steps along the way, and a keen sense of timing. A key skill is the ability to break down the steps into the smallest possible components and then understand which steps are going to be the most time intensive and which steps really require a significant block of time that maybe doesn't break up into pieces well. So let's talk through how to develop a federal grant proposal development timeline in the same way. And as you might have guessed, we're going to start our project management timeline at the end with the deadline. So for today's training, let's assume it's going to be May 31st. The second step will be to set an internal deadline. So I set this deadline up a week in advance. This is the deadline I always refer to, and this is the deadline that I'll guide my team toward. Continuing to work backwards, I put in a quality review process. I like all of my grants to go through both a copy editor and an independent reviewer, but these steps both take time. The copy editor might take a day or two, depending on their schedule, if I have them do the whole thing at once at the end. And for a reviewer, I might have that done all at once before the copy editor, or I might have someone looking at each section as I go along. If I have the time, I like the reviewer to look at it all at once, but there are benefits to looking at it section by section too. First, I could be working on another section while they're reviewing that section, so then ultimately I have more time to write. And also, problems can be fixed more quickly when they're caught early. So I'm not dragging a problem from the need section throughout the whole narrative when I've aligned my approach to a problem that turns out really isn't a problem. So if you look at a standard 6 to 8 week timeline between the RFP being announced and an application being due, suddenly you're really just down to 4 to 6 weeks when you figure in early submission and the reviewing and editing processes. In addition, if you're like most agencies, it'll take a week to decide whether to pursue the grant or not. And ideally, I know we would all like to work ahead, but especially with the federal government passing legislation that has significant new programs, which can be pretty common when there's a change in the executive or legislative branches, some of these grants will seem to come out suddenly, just from midair. So here are some strategies. First, when you ask your organization leadership to consider a particular grant, make sure you point out the financial impacts, whether you're currently able to deliver all of the required services yourself, and whether the grant requires that you have a full-time project director. These are all things that will impact how you develop the rest of your timeline, the budget, the partnerships, staffing. And then while they're debating that information, work on your timeline. Don't wait until after they said go or no go. Otherwise, you'd lose another week. So during this time, you make a list of what you need. You can group the items together, but you might not even know where some of the information is coming from. So I always start with a list for finance, and that would start with the budget, a list for the executive director, starting with any forms that they might need to sign, and a list for the data people in my organization. And this might include information on how many people and services we've provided that are most similar to what's going to be required in the grant in terms of outcomes, or I might be putting it in the organizational experience section, or might be pointing to a problem in the needs section. Either way, I know I'm going to need some service data and probably demographics. So I also then start my master checklist. And the checklist is really a version of the checklist that I'll use in the week before I submit. And my master checklist makes sure that all of the components of the narrative and all of the attachments related to the narrative, like the summary and the bibliography, are included. that the budget, justification, indirect cost rate agreement, and any partner scopes of work and any bids have been collected. Any other required or allowed attachments like logic models, work plans, resumes, bio sketches, letters of support, MOUs, anything like that are all connected and that they align to the narrative, and that I know how many and which forms need to be completed and signed before we submit. And this is what helps me determine the work that needs to be completed in the coming weeks. Now, there are 2 items on that list that I rattled off that too many people assume can be determined at the end and simply just added on as attachments, but I think they're crucial to program design, and that's the logic model and the work plan. So these are attachments that if you use them correctly, they can actually be really great planning documents. So I personally recommend starting with them. Work plans are great for making sure you have time and people to do all of the activities you say you'll do. And logic models are great for making sure your activities actually lead to the outcomes you're expecting. And then comes the hard part, knowing how long it will take you to write each section of the narrative. For example, writing the need section is one of the longest sections for me to write. And that's partly because the entire persuasive argument is based on the idea that there's a problem that we're trying to address, but it's also because it takes a long time to look up the facts that I need to support the reasons the program staff told me there's a problem in the first place. And then once I have those facts, I have to create the best visual representation of the data and the proper flow to introduce that data, point out how the data proves my point, and then transition cleanly on to the next concept. So let's talk about how to effectively use logic models and work plans to get the information you need as quickly as possible. And it's important to get information quickly when you're preparing a federal grant application. 6 to 8 weeks seems like plenty of time, but it really goes zooming by pretty fast once the RFP opens. Now, personally, I love to start with a logic model. Using the RFP, I'll fill in all of the required information that I can directly from the RFP. There might be required activities, specific evidence-based strategies, particular data we have to collect, or outcomes that we have to achieve. So in a perfect world, I would start out by talking with the team about the problems in the community that they think this program would address, but very quickly the discussion then flips over to, well, that just depends on what the grant can pay for. So instead, I'll start out by putting each of the required activities on its own line and each of the optional activities on their own lines. And then I might put all the outcomes in the far right column where it says long-term outcomes so that I can start out with the planning process with the team. So then when I'm discussing the project with my team, I ask them what resources they actually need to do each line of activities. I'll start out with who conducts the activity, which this leads to staffing and the organizational capacity, approach, management, and budget sections. Where do they do the activity, which this would lead to a building or a location, some information we'd need to include in the grants.gov forms, the budget, might lead to partnerships, and what materials they actually need to do the activity. And these would be items to put in the budget like supplies, evidence-based curriculum, assessments, that sort of thing. So I asked them if they have these resources now or if the grant will need to pay for them. And everything that the grant will pay for gets an asterisk. And this helps to start to build out the budget outline right off the bat. We can see very quickly in this logic model if we have too many activities that are going to cost too much money for the budget that we're actually allowed. So then I'll try to circle back around to ask the team to identify the needs in the community or in the individual agency that led them to believe these activities are actually the right solution. Even knowing the participants of each activity will help me start some of the research for my target population sections of the narrative. So then I go to the right side of the logic model and start asking the question, how many, over and over again for each of the activities? How many of these activities will be provided? How many people will participate in the activities? And then I ask, now how will this change the participants' knowledge, attitudes, or behavior? How long will it take for that change to take place? How will you know? The how long will guide me on which of the outcome columns to use, short, medium, or long term, and the how will you know will help to set up my evaluation section. So in a perfect world, I try to get as much of the logic model filled out in the very first focus project design meeting. This will also help tell me how much we still don't know, who doesn't know it, and perhaps even how long it will take to get some of those answers. And so then in subsequent meetings, the details about the activities will really start to fill in a little bit more. Now, when colleagues disagree about which services to provide, logic models can be great tools to help by pointing to what really aligns best with both the need of the target population and the outcomes that might be required or at least feasible to measure. So then at this point, I like to switch over to using the work plan as my planning tool. They are great for aligning other details I need in the narrative, like who is ultimately responsible for a particular component. This would be our management plan. Who will be involved in the activity? This would be partnerships in the approach section. How long does it take to do the activity? That's the intensity and the duration. Plus, is there a process milestone so that we know part way when the project is going well or it's not going well? When must planning activities start, even before the participant activities start? When will evaluation take place? What about things like dissemination or quality improvement? These are all important activities that don't always fit in a logic model neatly, but they're still important to talk about in the narrative. They're also described in a quality work plan, so you might as well use that work plan as a planning document when you're writing your application, since it's likely to be your guide after the grant is awarded, along with the logic model. I want to take a moment here. If any questions so far, Timothy, anything that's come through in the chat, anything like that? No? All right, we'll keep moving right along. So the next thing I want to talk about is how to design and run a series of proposal design meetings. So the logic model is still really only a visual representation of your project, and it rarely has all of the detail you need for the narrative. The work plan helps, but like the problem or need section, you still need all of the nitty-gritty details about the research or the evidence that supports the activities you're implementing. And for that, you probably need meetings that focus on the actual project design. So meeting management is one of the most important skills a grant professional should have to be successful with a federal grant. Without this, the grant timelines get behind because narrative drafts can't be written in a timely fashion. You have to have a good sense of what information you need, what questions to ask to get the information, and how to ask the questions in the right way to get people to talk about the details and not just give you some surface level answers. So while I start with questions directly from the RFP, because that way I can get my answers as close to what the funder is looking for right off the bat, really so many RFPs are either badly written or they're just super general. So I typically need to create my own list of questions. And I use these questions to dig deeper into the program with the agency staff so that I don't just sound like a grant writer when I'm writing the proposal, someone who's just reciting the RFP, but a person who's personally experienced with the situation. I liken it to what I would see if I looked through the window into a room where the activities are taking place or the services are being provided. Now, you know your staff or clients best. Will it be helpful for them to have a copy of the questions you're going to ask them in advance so they're prepared? Or would that overwhelm them if they saw the number of questions you're going to ask and maybe feel like you're being a bit too nosy, or will they even bother to look at it? Now, I like an agenda that gives them an idea of what we're going to talk about. And if I feel like the client can handle it, the questions that I'm going to ask in advance. Many of these meetings will point not just to data collection, but also to the key decisions that need to be made. So ideally, your agenda will provide those key questions for them to be thinking about and be prepared to discuss before they come to the meeting. I use minutes from previous meetings or the most relevant previous meetings to create my agenda. I also use the RFP and the topics that I've laid out in my timeline to make sure every time I meet with someone, I'm keeping on top of my own milestones that I've established. And another piece of advice is to make sure you always have more questions available to ask than you think you're going to have time to answer. The last thing I ever want is to get all of the key players into the room, have them answer all of my initial questions and make all of the decisions that I need them to make, and then we have plenty to get that group together again, time to spare. It might never be that easy, so I always have extra questions prepared so that if I have some key process. The first is the initial presentation, the pros and cons, the go, the no-go. This is a meeting that when you present the grant opportunity, you have a discussion with leadership about whether you're going to apply for the grant. In a perfect world, the decision is made at this point. Key initial items that you should have ready for this meeting would include how much the grant is worth and what they can actually spend the dollars on, including whether or not indirect costs are allowed and how much you can ask for in indirect costs, whether the grant pays for staffing, whether there are particular staffing requirements like a project director, and then how many years the grant covers. Organizations think about how long they can keep a staff person's salary paid for, and whether they're keeping them tied up in a project, and then whether raises and benefits increases can be built into the grant. And then think about how this grant aligns to what the organization already does, the mission, the services, the target population. If it requires evidence-based programs, make sure the organization is prepared to implement them. If it requires activities they don't currently provide, you have to be prepared to talk them through that too. And so a go, no-go meeting can really hinge on any of these things being or seeming insurmountable, or at least just not even worth the time. The next meeting would be information gathering. And that's really to determine if there's sufficient need in the community to really be competitive for the federal grant opportunity. And there are definitely times when people can anecdotally tell me that there's a need, but they can't really prove it with data. So they just decide to pull the plug on the project because there's no way to set the core why needed to persuade the reader and really submit a competitive proposal. The next would be decisions on components. Other information gathering will be designing the approach of the project. Now, sometimes from services you currently do, sometimes from scratch. Making sure you've allocated enough time for your organization to create and potentially recreate 3 times over the approach you're going to take will be one of the craziest parts of a federal grant professional's project management experience. And because, as I mentioned earlier, changing one component can have a ripple effects on other areas, especially as you get into your attachments. The next is a partnerships meeting. A prime example of meetings with partners or about partners is making sure they understand what level of commitment is required from partners or what level of commitment is strongest in the proposal. Now, I've written many core sentences for letters of commitment only to have them either watered down or completely eliminated by organizations that were unwilling to use strong language of commitment. It does make you wonder how well the partnerships will work or not work once the grant is awarded. Another meeting will be about staffing. And a lot of times I can get what I need for the narrative regarding staffing when I do the work plan, but attachments regarding staff are always fun. And I like to provide checklists to everyone in the room about what I'm going to need from them. And it's not unusual for me to have a meeting to say, now half of your time is being paid by this grant. What exactly are you doing? Or yes, you must give me an updated resume, not the one you provided when you came to work here. And yes, it must have all of your job titles and responsibilities aligned to what we've already said that you do for this grant and that you told me you've been doing for the last 3 years. And lastly, a meeting dedicated to evaluation and data collection. Actually, not lastly, second to lastly. It's always fun because most of the time, no one wants to collect any data, but the grant will require a very specific, precise evaluation. Or the client maybe only wants to collect output data on the activities and not actually measure any outcome change in the participants. Those can be really intense meetings where pulling out that logic model can be incredibly helpful because they can then see that I've highlighted a box in yellow for them to figure out what they can measure, or I've provided some draft language for an outcome idea so that they can make modifications that suit their target population and their existing data collection system. And then the last type of meeting would be financial. And I always get asked about whether I do a financial meeting. And I don't always do a big meeting about the budget because in some organizations, it would become like a Christmas tree with everyone creating a list of all the costs they want to hang on the grant. But there's always a meeting with finance and the primary program person at least to make sure we have a strong alignment between the narrative and the budget. So now we're going to dig in a little deeper on one of the key elements of program design, and that is evidence and research. Now, how many of you have ever been asked in an RFP, what is the level of evidence for your program, model, or services? Is there research or other evidence demonstrating that this program can be successful when implemented in accordance with the program model on which it was based? What documentation do you have of your evidence-based or evidence-informed approach? To answer these questions, we need to make sure everyone here has a firm grasp on the vocabulary we're going to use throughout this section of the presentation. And you can refer back to the slide. One of the most confusing things funders do is use the phrase research-based and evidence-based almost interchangeably. There's actually a difference, which is that research-based simply means there are theories behind the activities, but they aren't always proven true. And that whole idea of proven true is a tricky question of to what degree have they been proven true? And then evidence-based means that there is efficacy to back it up. Efficacy means the ability to consistently produce a desired result by recreating the same actions. Now, the confusing part here is that typically an evidence-based program is a set of activities developed from scientific evidence, and using research, it's been found to be effective based upon evaluation. So evidence-based programs are research-based, but research-based programs may not be evidence-based. If this sounds confusing, think of it as this. A peach is a fruit, but a fruit may not necessarily be a peach. So this means that if the funder is asking for research-based, you can use your evidence-based. But if they're asking for your evidence-based and you aren't using an evidence-based program, you need to be really careful about how you actually describe your program. And we'll talk more about that a little bit later in this section. Now, most evidence-based activities and programs have had their research published, and frankly, because they're proud of it, but also to share this information with others who are trying to accomplish the same outcomes. This research is typically published in a peer-reviewed journal. Peer review is a process of subjecting research to the review of other experts in the same field, typically before publication. And in academic publishing, peer review assesses the quality of the research and articles submitted for publication. The review helps to validate the research, and it establishes a method by which it can be evaluated. So this means that you're looking for research articles from publications which use this process, such as the Circulation, Hypertension, and Stroke from the American Heart Association, JAMA, or the Journal of American Medical Association from the American Medical Association, or the journal Nature, which is actually British and is old and it's been around for so long, but it has a very, very precise peer review process. And it's actually one of the most cited scientific journals. In education, these journals might include the Journal of Higher Education, the Journal of Educational Psychology, the American Educational Research Journal, or the Journal of Teacher Education. If you don't know them for your field, just do an internet search on the field you're in, and then you can add the word journal at the end. So like Journal of Social Service Research, Journal of Social Work, something like that. And that's how I found some of the first journals I used when no one could tell me where to start. And what's really great is that the way Google's doing it now, they just pop up a whole nest of journals at the top. So as an example, I did that with social work because social work is not my field in particular. So I just said social work journals, and it came up with a Journal of Social Service Research, Journal of Social Work, and so on. And for those of you who are in human services, that might be the place that you find that kind of peer-reviewed research. There's also Google Scholar, which is a separate site that you can go to, and it just automatically populates with all of these peer-reviewed articles. It's really great. So some programs and activities have been built into a specific model. And this means that activities have a prescribed target audience. They have a very specific intensity or contact time and duration, which is the total length of the program, and steps to complete with the participant along the way. This is most common in healthcare and education right now, but we've also seen it in substance abuse treatment. And I'm not saying there aren't other models out there, but I know a lot of the examples that we're going to find, and they're the easiest to find in those three areas. And fidelity is the degree to which this model is being followed. So for example, the most common reason to be outside of fidelity is when people provide the services to a population that's different than the original published target audience. They also may not have the same intensity or duration. So the model creators would then say, well, you might not get the same outcome result then. So for example, if the program was originally written for young Hispanic males in the urban core, and then you go and do that in the suburbs, they're not going to guarantee that it's actually still going to work there because their experiences might be different. Poverty may affect it, and frankly, their geography might affect it. And we've found that things that have had a research base in Los Angeles or the boroughs of New York don't work here in the Midwest all the time. Some would say it might be the Midwestern values or any number of different reasons that just make our experiences different here. So using evidence-based models aren't always perfect, but the research though, well, we'll talk about the fact that it should be within a certain range. Now, one of the best responses to this might be to instead work with the original researchers to examine the changes that you're proposing to make and to see what level of outcomes you're able to achieve with your level of fidelity. Some researchers might work with your project because they want to add it to their data. They want to show that it is evidence-based with as broad of a target population as possible. But from our perspective here today, you might just say in your narrative something like, this program has been validated with Hispanic, African American, and Caucasian individuals with kids ages 12 to 16 and with kids ages 16 to 21. Just clarify. And many models will have specific assessments that you need to give as well. Or some assessments have been created independent of a program. And using an evidence-based tool is a great way to talk about evidence-based without actually having to have an evidence-based program. So here, the focus would be on the validity and the reliability of the tool and the results which are measured by the tool. Now, there are different levels of evidence. This is where it starts getting fun. And yes, I've been told before that my definition of fun is maybe not, maybe could use a little bit of work. But let's look at category 1 to start. Category 1 is actually the highest level of evidence, and it decreases in statistical significance as you get to a category 5. Opposite of hurricanes. So category 1 is well-supported research. It's like 2 or more randomized controlled outcome studies comparing the target treatment to an appropriate alternative treatment and showing a significant advantage to the target treatment. This means people did not pick which services they received. It was random. Think randomized numbers or numbers out of a hat. And you're comparing the target intervention with whatever practices you're currently doing or what the gold standard is for your field. In education, when they do these types of studies, some teachers just do what they've always done. And then we have teachers that do the new curriculum or the new activity. And it's similar in the medical field. One person gets the current practices and the next person gets the new practice. So what you're looking for is that those who are getting the new curriculum or the new treatment hopefully have a better result than the current practice that's going on. Now, some institutions don't implement randomized control studies. For example, we work with a hospital system who only implements what is known to be best practice. They don't do research because they don't do something that might be considered questionable. With that said, we also work with institutions who absolutely are doing this, and they're developing wonderful treatments for people along the way. And if you're somebody who has cancer and the current treatments aren't working, this is how these new treatments get developed. The US Department of Education has a different word for this level, and it's considered strong evidence. So you might see that term as we go along too, depending on your field. Now, category 2 is supported research that's been shown to produce positive outcomes. These might include non-randomized designs with some form of control group, which may simply mean one group gets no treatment. The US Department of Education typically refers to this as moderate evidence. Category 3 is supported and acceptable treatment. It includes interventions supported by just one controlled or uncontrolled study. It's common for an organization to point to published research and say, oh, this is what we're doing. But it might be that that's the only study that actually explains what you're doing. And this is actually category 3. There's nothing wrong with category 3 per se, but it's just not been randomized. It's not been studied with a lot of different kinds of people. There might be a series of single subject studies that were done, or maybe they were done with just one small population, and it just hasn't really been compared with other populations. The US Department of Education might refer to this, depending on the type of study, as moderate evidence, but more commonly as preliminary evidence. So somebody's done one study, and now they haven't really replicated it in a randomized way to know for sure that it works. And in addition, the issue of different populations is a major factor here. It hasn't been proven to work with different populations. And this is pretty common in human services and even in education. You know, too often we assume that a successful intervention in one context or population will be successful in another. That's not always the case. And increasingly, we're seeing the same question in federal grants, like Substance Abuse and Mental Health Services Administration, SAMHSA, asks, is this in an identical or similar population? And then you, as the grant professional, have to explain what the similarities or differences are to the original or the approved population for that intervention. So category 4 is still considered promising and acceptable treatment. This category includes interventions that have no actual research support. So if you start trying to find research support for something you've been doing for 10 years and you ask your program people, they just tell you, nobody's ever really published on what we do. Just know it works. We have good outcomes. So it's just general acceptance. Perhaps the clinical literature has even anecdotally talked about it, but you just don't see a formal study on it. However, any evidence of possible harm excludes any treatment from this category. It can't be a category 4. The U.S. Department of Education typically refers to this as evidence of promise, but this does not typically get you full competitive preference points from them. Private grant-making agencies typically will allow this to serve as an evidence-based practice, but it really is pre-preliminary evidence. Now, the last one up there is category 5, and it's innovative and novel treatment. This might include interventions that are not thought to be harmful, but they're just not widely used or discussed yet in the literature. And then there is another one, category 6, which I haven't even put on this slide, and that is a concerning treatment. This is the category for something that someone has done in a particular practice, but we now know that we shouldn't do it. Perhaps someone developed something like a drug and they did it in an absolutely ethical way, but then they got it out to the general population and they really started dealing with all of the different quirks of humanity. And they said, okay, there really are some problems here, and they've had to take the drug back off the market. That would be considered a category 6. In education, some would call corporal punishment in the classroom to be category 6, physically inflicting pain on a student. We've all kind of agreed that this is probably not something we should be doing in our schools. It's category 6. All right, I want to take a break here really quick just to see if we have any questions so far. Anything pop up in the chat? No?
No, I don't see anything. We just did have a question about where the slides are going to be saved.
Oh, nice.
And so I did send another response to that, again, on the OPR Federal Grant Resources page. But yes, any other questions, please feel free to put them in the questions tab. Thanks.
Yeah, sounds good. Thanks, Amy. All right. Well, there are many factors that determine how you actually describe evidence in your grant proposal. The number one thing that all people seem to be concerned about are citations. And one of the trickiest aspects of this are online applications, those portals that don't actually allow for traditional footnoting or a references cited page. So for these, I'll typically just put some information in a parenthetical citation. I would include authors, year of publication, the name of the article, and the name of the journal. And so this will give the reviewer key data points of who, when, what, and where for the evidence or the research that I'm citing. And classifications are another way to give information about the strength of your evidence without long word or character counts, because sometimes that can be a really big problem with grant proposals as well, right? So simply telling the funder that the program is based on strong, moderate, or preliminary evidence will provide them a basic idea of where your program falls in the evidence spectrum. For most grants, this really is all that you'll need. If you're applying to a major federal or state government grant or a major national foundation, you may also have to go into greater detail about each study you're referring to, especially if your program is grounded in only a couple of them. So for this, you might discuss how closely the model aligns with the proposed program, the methodological quality, the recency of the study, and the overall strength of the findings. So we've got a few examples for you here, and in this first example, this is the model that was used, the Rural Services Integration Toolkit, and we just provided a simple citation because it was published by HRSA, and we were applying for a HRSA grant. So HRSA already considered this a respectable source. Sometimes even in RFPs, they will list these preferred models or sources for you, and so you already know that the reviewer understands that this is preferred practice. In this second example, the citation notes that it's a systematic review for the United States Preventive Services Task Force. Now, that's an independent panel of experts in primary care and prevention that systematically reviews the evidence of effectiveness, and they develop recommendations for clinical preventive services. So another wording I see in titles or descriptions that examine multiple studies around a topic is meta-analysis, and that's the statistical procedure for combining data from multiple studies. So when the treatment effect or the effect size is consistent from one study to the next, you can use meta-analysis to identify the common effect. And the description here on this example describes the types of interventions that were examined and what result ranges were achieved. So in this example, the examples are getting longer every time, right? You'll see more specifics from a US Preventive Services Task Force recommendation statement. And this one has more detail than the previous citation, including the number of studies, the type of studies, the intensity and duration of the interventions, who the interventions were with, and the results and strength of the overall findings. So this parallels back to these pieces here at the bottom. The date of the study is going to give you some of this, but as I said, it talked about the strength, it talked about the sample sizes, it talks about what these things had in common. Okay. So here you'll find a simple answer that refers to preliminary evidence in intervention 1 and 2, as well as a reference to an accepted evidence-based practice of SAMHSA. So number 1 was followed by multiple citations for each component that we described. And then number 2 simply showed the reference that's listed down below it, and that was for the SAMHSA practice. Okay. And just in case you think we only write about evidence-based programs, here are some examples of interventions that are not strong, they're not moderate, they're not even preliminary. They're considered pre-preliminary, or you might have some kind of data in number 3 that points to evidence of promise, which is how the Department of Education would put it. And the reality is that most of the human service organizations we work with fall into this category because the services they provide have general acceptance, but there's just no literature on them. And for many hardcore evidence-based funders, this would be considered really weak. But thankfully, in this instance, we were combining it with other stronger programs and activities. Now, a really strong grant writer will probably really have to dig to try to find something to support these activities. And we did. Dug and we dug and we dug. And we just really weren't finding a single study that was published on these issues. But if you're a senior or if you're an individual living with physical disabilities and you can't get out of your home because you need a ramp because now you're in a wheelchair, if someone can come in and build you a ramp out of your house, a lot of times you can get out into the neighborhood. And studies have shown that if you're not stuck in your house, you have stronger mental health and stronger physical health due to socialization and, you know, being able to get to doctor's appointments and things. So those were the types of things we were able to point to, but nothing that we could find that said building a ramp improves mental health. These types of studies just weren't out there. So the bottom one, we literally were just honest. There's no qualitative data. There is no quantitative data. We hadn't collected anything. It was a brand new program. It was being developed, and we just had to explain how we were doing it. We were developing it because of conversations with caseworkers about the quality of the homes that they were walking into. Okay. So where can you find these paragons of evidence? Well, we've listed here on the slide some of the biggest sources, and that includes What Works Clearinghouse, that's for education. The Community Guide is great for population health. The Evidence-Based Practices Resources Center for substance abuse and mental health, and this actually replaces the National Registry of Evidence-Based Programs and Practices, NREPP, which was terminated in 2017. The ECRI Guidelines Trust, that's a repository for clinical practice guidelines, which was formerly the National Guideline Clearinghouse, put out by the Agency for Healthcare Research and Quality. The Promising Practice Model Database for Prevention Services, which is put out by the National Association of County and City Health Officials, and crimesolutions.gov from the Office of Justice Programs. So in addition to these, there are many databases out there that are even more topic specific, like the United States Preventative Services Task Force, the Compendium of Evidence-Based Interventions and Best Practices for HIV Prevention, the Model Programs Guide, and What Works in Reentry Clearinghouse. Haven't yet been able to find anything completely comprehensive for all areas because, you know, no one can be an expert in everything. Any questions on any of these? Okay. So what happens if your services or your programs don't show up here? What if you're innovating, you're meeting people where they're at, you're responding to the diverse and adaptive needs of underserved populations, right? Aren't these the terms we use to describe community work? Community work is messy, and I believe more and more funders are starting to acknowledge this fact. So Maybe you did a review of the literature when you set out to meet the needs in your community, and there's just no intervention model that offers exactly what you need. And perhaps your work has led you to serve target populations for which interventions have just never been part of a validation study. Or maybe the reality of limited time, limited funding, and staff turnover all make delivering rigorous evidence-based programs just unrealistic. And quite honestly, most programs being delivered are in the no or preliminary evidence category. It's just a fact. So if that's true for your agency, how do you describe your program model that's in those lower levels of evidence tiers in a way that will allow you to be increasingly competitive for grant proposals that are asking you to describe the evidence or research? Well, first you need to read the RFP really closely to determine whether the funder will consider deviations from an evidence-based practice, because sometimes they just won't. So that needs to be a part of that initial go, no-go meeting. But let's talk about some strategies for how you might make a case for your program that's not a complete evidence-based model. Maybe it's a framework that has a collection of evidence-based, research-informed, and just good ideas based on experience working with a particular population. And if deviation from an evidence-based practice does appear allowable according to the RFP, it's important that you tell the funder which components of your program model will be delivered with 100% fidelity, which components are deviations, and then when there's 0% to fidelity. So for the components of your program that are 0% to fidelity with a model, be prepared to discuss why. Be confident in the power of practice wisdom. And this includes the intersection of evidence, research, and experience and knowledge of the community that you are working within. Next, give some examples for how your program model does meet fidelity. When there's deviation, discuss the potential value add that your deviation offers. This chart provides an example for how a middle school, college, and career prep program could be slightly modified. Now, a table like this that points out a modification should always be followed with a description of the modification. And this particular table was created by a grant professional and GPC colleague, Cheryl Kester, who is also an expert on federal grants. And she and Karen Cassidy have created a book and workbook about writing federal grants. This is a great example. And another example, maybe you've selected your evidence-based curriculum framework, but because of funding or staffing limitations, you're going to deliver 2 sessions a week over 5 weeks instead of a weekly session for 10 weeks as the model prescribes. So discuss any of the practice wisdom that you've seen in your organization that informed this change, and then just describe how you'll document the process closely to see if your results can actually inform future work. Now, particularly if you're not applying for a federal grant, but instead maybe you're applying to a funder that's asking you to describe the evidence behind your program, you might have a bit more flexibility to deconstruct your program model and then really talk about the parts of your model that are based or informed by evidence or research. Now, this one here is an example from a mental health grant that we submitted to the Health Forward Foundation in Kansas City. And this applicant just established that the overall theoretical basis of their program was the ACE study. Let's kind of read through that. Now, this slide offers some examples for how you can talk about how you're incorporating evidence-based strategies into your program plan. The first one is language that we've used in successful 21st Century Community Learning Center grants and in AmeriCorps proposals. Now, what's important here is the focus on the outcomes. So in that third example, the organization is basically saying, we want the same outcomes that the healthcare organizations do. And the proposal then will go on to explain how the social service agency is going to address those social determinants further upstream than the healthcare organization actually can. Okay. Now, this slide is an example of a grant to the Health Forward Foundation also. And the collection of activities that the school-based mental health professional may do will be informed by research and evidence, but it's a model that meets the needs of this particular school. However, they will hire professionals that deliver evidence-based practices and screening curriculum. Now, finally, you can build a funder's confidence in your capacity to make decisions and deliver strategies based on or informed by research or evidence just by describing who you work with. This excerpt here is from a CDC proposal in the partnership section. The applicant was actually the regional hospital, and while they had other capacities that made them a really strong applicant, their affiliate hospitals actually had the experience of delivering evidence-based public health programming within the priority population that the RFP required. And so that's when this partnership really strengthened the overall proposal. So what are the next steps that you can take right now to be prepared to apply for federal grants with these project design elements in mind? First, develop your standard 6-week project timeline that your organization staff will agree to. This will help you quickly have a timeline ready the next time your federal grant drops. Next, develop that standard list of questions that you're going to ask your finance staff and your program staff. Now, these are the questions about activities like who will provide them, when will they provide them, where will they provide them, how many activities will you provide each year, and will that increase as you move past the first year? Next, if you can, have a logic model about all of your agency's standard programs with outcomes that you have a base to work with. That's one of the first things we like to do with our clients is help them actually create a logic model of all of their programs and services so that when we have an opportunity come up for one that meets one of their programs, we have that already available that we can work from. Know who the standard staff are for each element of grant implementation, from program to finance to data collection and analysis, so your work plan can be templated as well. For example, it's not uncommon for me to have a standard section that I use for the management plan of a grant proposal or the evaluation section, because the organizations that we work with often have already developed that language for how they implement those processes. It's really not going to change all that much. Hopefully you're just adding more experience with different federal agencies as you go along as they're awarded more grants. So then along with the logic model and the work plan, try to develop a list of literature that your programs are based on, whether these are evidence-based models or research on particular activity elements that you might provide. And when I'm able to plan ahead because I'm writing for an already developed organization program, I can collect the actual articles that will give me the most detail about research validity and reliability or the size and effect of the research conducted. I already have those in my back pocket. And then just in case you're thinking, but what if my organization develops a new program instead of a current program they're implementing? Well, the good news is that all of the skills you develop by preparing these items for your current programs will help you to complete these design elements more quickly under the pressure of a federal deadline. Practice increases efficiency. Okay. Any questions? Anything new come in the chat? Anything anybody's thought of?
Yeah, Leah, we did have a question, something you talked about earlier. You mentioned staffing and the need to potentially attach resumes to the application.
Yeah.
The question is this grant dependent or generally a good practice for any federal grant?
So it is grant dependent. There are some funders in an RFP, they will outline all of the different attachments you'll be required to include. And a lot of times that does include a resume or a bio sketch for your main program people, the key personnel, typically the project director, maybe the evaluation person, maybe the data coordinator, that sort of thing. But honestly, if a grant doesn't require those things, I still like to ask for them in those initial meetings for those key personnel, because then you have all of that information, because odds are there's still going to be a section that talks about organizational and staff capacity. And so you can start to pull some of those things from their resumes. You already have the language that they've used to talk about their education and their credentials. So a lot of times, yes, it will be a required attachment. And there are some agencies that have their own templates, and they like you to keep it to 2 pages, and they like you to use their specific template. So always look for that in an RFP, but it's not necessarily always required. If they don't ask for it, don't include it. Any other questions?
We have another question that came in. When you write a letter of support for a grant, or when you have a letter of support for a grant, who should it be addressed to? to the agency lead or the funding agency? So sort of best
Yeah.
practice for that.
That's a great question. And a lot of times we will address it to the funding agency. The exception would be in that some agencies don't always give you a contact person. They don't always tell you who the program officer is. And so in that case, we might have them write to the executive director of the applicant agency or the project director, something like that. But typically we would default to the contact at the funding agency. It's a great question. And sometimes, again, in RFP, sometimes they'll tell you what they prefer, but that's how I would default. Okay. Any other questions?
And let's see, another question here. Do regional plans fall under evidence-based or research-based? This would be looking at a funding opportunity like housing or trail development.
Mm-hmm. So typically a regional plan won't fall into either because it's not actually something that's published in a peer-reviewed journal or peer-reviewed publication, but those documents are so important for needs sections. So that's one of the first things I like to do, especially if I'm writing, say, a grant for healthcare or behavioral health services. I like to look for those, the community health needs assessments or the regional planning documents around those as well, because you can, a lot of times they've already done a lot of great research. They've involved stakeholders in the community. There's a ton of information in there. You mentioned specifically like trail development. That's another great one. If you can show in your program design that what you're proposing aligns with these regional initiatives, and then you can get letters of support from the elected officials who are leading those initiatives or championing those initiatives, then those are all things that are going to strengthen your proposal. Unfortunately, they wouldn't fall under evidence or research, but they're just incredibly important to gather those things. Great question.
Great, so more as like the need-based need evidence there. So I don't see any other questions, but we do have a thank you from someone who's brand new to grant writing and found this webinar. It's helpful as they're trying to absorb as much knowledge as possible.
Good, well, welcome. Grant writing is great. All right, well, thanks everyone for joining us today as we looked at how to really gather and present the information on your program's quality project design. I hope you've been joining us throughout the year in this series, and our next session is October 13th, and we're going to talk about building a compelling federal budget. And if you're interested in a certificate for today's training for documentation of your attendance or continuing ed credit, please email me. My email address is up on this slide. And if you're interested in other federal grant training, you can check out our federal grant series for more information on pre-award and our grants management series for more information on post-award. And we also have leveled grant training and trainings by topics such as ethics and grants training series. And to learn more, you can visit our website, which I believe got a link in the chat, acelgrantservices.com/trainings. Okay, well, have a great day, everyone, and good luck with all your federal grant proposals this year.
Great, thanks everyone. Hope to see you at our next session.
Thanks.